It's bizarre to get concerned about prostate cancer and not be concerned about your heart, because most patients with prostate cancer die from their heart. So therefore, heart healthy is prostate healthy. That's not just a saying. It turns out that there are foods and supplements that are helpful for the heart that appear to have benefit for the prostate. So that's principle number one. Now, how did we ever get into foods and supplements for prostate anyway? And this was based, for the most part, on population studies. What is the incidence of cancer in the Far East? What's the incidence of cancer in the Mediterranean? This is a relatively loose way to find supplements and foods, but it is how a lot of the opinions and the ideas that you will read about in various sources that talk about food and supplements, where this comes from. There is research that's been done that is an attempt to try to make it more scientific, but that's where the source is. So this is a study that was begun in the later 90s. It was called the Prostate Cancer Prevention Trial. Over 18,000 men, split in half on a drug called Prostate, half not. They had to have certain requirements. They had to have PSAs 3 or lower. They had to be 55 or older. Their rectal exam, digital DRE as we call it, had to be negative, and they had to agree to have a biopsy, if appropriate, during the course of the study and at the end of the study for everybody. So this was a large group. The data is unbelievable. What did it show? First off, some of the men here may be on drugs like this. This category of drug is called a 5-alpha reductase inhibitor. I can tell you where it came from, but that's less important. What's important is some men are on this drug, and the reason we give it to many men is because it shrinks the prostate. Over a period of 7 years, the men in this study had their prostate shrink by 25% or better. And when the prostate shrinks, it turns out that you can urinate a little better, and should you have a question about prostate cancer, the digital rectal exam was clinically, statistically proven to be a better exam than it was before the Prostate. And if you needed a biopsy, the biopsy proved to be more accurate. So if you had prostate cancer, taking this drug for these reasons as a start makes it easier for you to find the cancer. So far it sounds good, and we haven't even gotten into prevention. So what about prevention? First off, when the study initially was closed in 2003, it was actually closed a year early. That's because the committee that controls the ongoing study said we can no longer support continuing the study because the group on Prostate was having such a good benefit. It was no longer appropriate to keep the folks on placebo. So the conclusion, this is one of the few evidence-based, double-blind, placebo-controlled studies that actually has shown that we have a drug that will potentially cut the incidence of prostate cancer finding. And what our recommendations from this study logically might be is that if you were 55 or older and on a plan of yearly digital rectal exam and PSA testing, it would be reasonable for you to discuss this with your physician to see whether you might be a candidate